Again, thanks for finding us here at MedMasters. This is our very first one. We're so excited is an understatement, not only to be here with you as MedMasters, but also to have Dr. John Harmon as a host. Super appreciative to the MedMasters team for pulling this together and making this work. It's been quite the journey the last few months, as we've had to make some really, in some cases, unexpected changes, but it's been transformative and fun. And again, we're glad that you found us. If you're new to either Jason, Vicky, or I, or the team at MedMasters, we have been training for a long time. We've been doing virtual and on-site trainings for quite some time, several years. So that's why some other people might know us, but if you're new, that's great too. All right, I wanted to just introduce MedMasters a little bit, just take a couple of minutes to do that. Yes, my name is Kim Look. I am whatever you want to call me, the director of content, or I don't know what names are floating out there, but and then Vicky Linnemeth is here with me and Jason DeLeon, and that's our MedMasters permanent team at this point. We do still teach on and have revamped and revised and made better all of our ozone and ultraviolet training materials, or UBI, or photobiomodulation IV techniques, which is one of the reasons I was so interested in Dr. Harmon's technology. We are advancing that as well. We have many topics that we can now teach and train on. And so we're growing and developing. We do function a little bit different. Our model is a little bit different. So we have membership options now. You can become a MedMasters member and get access to all of our training material. There's 2 tiers of that. We still do on-site training. So we come to your office, especially if you have an EBOO, extracorporeal blood ozonation oxygenation machine. We also have live virtual, funny how that is, live virtual trainings, and we have a couple of those coming up, or one specifically. So Jason is heading up our All Things Ozone class on March 9th. So this is how to integrate ozone from start to finish, both IV and non-IV applications. We have a few guests coming in. So a guest on ozone and joints, a guest on ozone and aesthetics, and a guest on ozone oils. They're going to be helping us do the presentations. But, you know, if you have an ozone machine and you feel like you're not fully utilizing it, or you need protocols. So we're going to be super practical. We're going to review all the equipment necessary and give you the protocols for each one of those applications. You may still need to purchase equipment, or you know, you may want to bring in a new way to do ozone or whatever, but we'll give you all the protocols there on that day. Vicky is going to post in the chat the links that you can go to register for that. So again, it's March 9th, 9 to 4 Eastern time. It will be live. If you register, you can get the recording for sure. But that is our first MedMasters first live virtual day class. We host short meetings all the time. And then May 3rd and 4th, we will have our first on-site or in-person live train event with Lexi Yu. She's a specialist in aesthetics, among other things. We're going to be at her practice, which is phenomenal, in Noblesville, Indiana. We are taking a very small group of people because this is going to be very hands-on. And very focused on certain protocols or injection techniques. So if you would like the chance to hold a needle, actually inject, or be injected, that will be there. So anyway, May 3rd and 4th, Vicky's going to post the link for that as well. You can go straight to that. And by the way, we are offering for the All Things Ozone class a $50 discount for the All Things Ozone class if you're here today. And that discount is already reflective on the link on the website. It will disappear tomorrow at midnight. So that offer is just for you guys here today if you're interested in learning more about all the ways to apply ozone. Dr. Harmon.
Yes, ma'am.
I think that we first met over the topic of ozone, like
yes, you were participating in as a trainer for my ozone training.
Yeah. And you did it in your practice for a while.
Yeah, quite a long while.
Yeah. I won't put you on the spot and ask you what you think about it, but as I was reviewing your book over the last several weeks, it's interesting to me how there's some crossover with these copper peptides and ozone, which is another reason why I'm so fascinated in it.
Yes, and I'm telling you, I don't know if you recall, but they used me as the guinea pig for that severe glute and leg pain I had for the trigger point injections and the ozone, the prolozone
That's
in
right.
the
That's
lumbar
right.
spine. And I got up and walked out and stood up, drove all the way back to Boise from Pocatello, and then was able to stand up longer than 10 seconds that I couldn't do for 6 weeks. So it was a miracle for me, and that then I implemented it into my practice until
I
the
do
FDA
remember
changed
that.
the law.
Yeah, the laws in Idaho have been fluctuating, but I do remember that. And we did some like muscle sub-Q tissue injections with ozone. It wasn't just a joint space, which is relevant to how you use
Right.
ozone. And a lot of our trainers are really particular about saying that, right? It's not just the joint, you can treat the whole area and you really want to with ozone. So that's a good reminder. I appreciate that. Well, I want to just say one thing as we introduce you, and I'll let you do the technical part, but I do have a signed copy of your book. Thanks for sending that to me. And as I opened it up, I thought this was just a great introduction to the topic today because he writes to me, please use the information in this book to number one. And I apologize if you write this in every book, Dr. Harmon, you're now going to have to change it. But here's what he writes, and I think this is so valuable to the topic. Please use the information in this book to number one, get younger. And I'm thinking, yeah, I will. And number two, increase your circle of influence and your ripple effect globally. So I really hope you guys can listen to Dr. Harmon today. Use a lot of this information to, yes, number one, help yourself look, feel, and be younger. And number two, influence or create a larger circle of influence for those that you treat, those that you speak to with the information you learned today. Dr. Harmon, tell us a little bit about you.
Well, there have been two things that have affected me tremendously. One of them was the training that I did that helped me with the issue that I had. And then when, through the use of copper peptides, the right bundle branch block I had in my heart went away. That is what motivated me to write this book about copper peptides. I got a little frustrated. I went to, PubMed, National Institute of Health. I was looking for research about this peptide, and there wasn't a resource. And so that's what I did. I put together all of the global research about mostly the GHK-Copper Peptide and ways of administering them and getting those peptides. So the book is kind of like my Bible for when somebody says, well, what is this? What does it do? Well, your category. There are 3 chapters on the brain. There's a chapter on cardiovascular health, chapter on skin, and each different organ system gets affected a little bit differently. And the pathways are all described in the book. So a little bit about me. I was a chiropractor starting in 1990. I moved to Boise from Los Angeles area, started my practice, was moving along. I was doing a lot of extremity work and cranials, and I basically could, adjust every bone in the body. And then I was doing some work in our gazebo, and I went into one of the pillars, and yellow jackets flew out of my face, and I jumped off, twisted my hip, and then for the next 6 weeks, couldn't stand up longer than 10 seconds. And that was what you just heard about. So that was life-changing for me. But the big life changer was just about that time, we had a suicide and a murder in my family that caused my younger daughters to really have bad anxiety, depression, and insomnia. So we went through 4 years of prescription drugs and counseling. It wasn't working. I decided I was going to go find things to fix brains, and when I started Clear Mind Idaho, I got board certified in QEEG and neurofeedback, and off I went and redesigned my practice. And now we help people with brain issues. Most people in my office have an imbalance in their autonomic nervous system. They're stuck in sympathetic freeze. They can't shut their mind off. They can't sleep. They have anxiety, and on and on and on. And we fix that. So that's what I do. I've incorporated elevating copper peptides because of the study that was done on brains. And they did a measurement. They did lots of measurements, but the one that they reference is called coherence, and that would be the crosstalk or amount of activity between lobes in the brain and front to back. The more hypercoherence someone has, the more autistic we are. The less coherence we have, or hypocoherence, that's more cognitive decline. And through copper peptides, it's like an adaptogen for hypercoherence and hypocoherence. It brings those measurements closer to normal. So I started incorporating this into my practice. So that's just a little bit of background. The murderer was my son-in-law. He was an attorney in town having an affair with his paralegal, and apparently husbands don't like that. And he paid the ultimate price. And that's what was the big shock to our family that set me on this other course.
So highly traumatic. I actually have seen that story a couple times in national news or national media publications, but I'm sure that there are a lot of variations of that type of trauma, or lesser or more to varying degrees, that really set people into PTSD syndromes and other categories: depression, anxiety, suicidal, all sorts of things, right? What's interesting, or what comes to mind for me, and that this just shows how naive I am, I guess, but I was turned on to GHK because it was the beauty, skin, anti-aging peptide, and you just took it down a whole nother path that maybe some of the providers here are familiar with. But I do and would love for you to take, I know it's all in your book, and we'll let you introduce your book. I know we've got that question, but I know there's a lot to say about that. But if somebody asked you the top 10 ways or the most noticeable things that you have learned or have seen about activating or using GHK, what would you say?
Well, I have a presentation that I have done for the Energy Healing Conference. We talk about the top causes. What are the mechanisms that happen that cause us to age faster and die younger? Let's just take cardiovascular. How does the GHK-Copper Peptide affect the cardiovascular system? There are lots of ways. Number one, a high fibrinogen level is the number one predictor of stroke. It makes our cells sticky, and they have to have a little stickiness in case we get a bleed. But the GHK-Copper Peptide inhibits overproduction of fibrinogen, so essentially keeping our fibrinogen levels more in the normal range. Basically, what it does, it turns off a gene that makes part of the fibrinogen molecule, so that your body can't make too much of it. I should say it modulates it, doesn't turn it off. So there's that with the fibrinogen. It also, the GHK-Copper Peptide increases myostatin production. Well, what is myostatin? Myostatin inhibits cardiac failure, heart failure. Then there's the other effect how it affects cardiovascular system. Whenever in our body, whether it's our skeletal muscle or the heart muscle, whenever there's a deprivation of oxygen, there's an alarm that goes out, and it's called hypoxia inducible factor. What happens, HIF1, when you have a deficit of oxygen, there's this alarm that goes off, and the GHK-Copper Peptide is sent to basically chemo attract new capillary growth into tissue where you need more perfusion. So the endothelial cells start to get excited, and then they make some enzymes to poke some holes out so the endothelial cells can go out and make new capillary growth. Well, you think about the heart. Well, why do we have an MI? We don't have enough oxygen. Why do we have, when we're working out, why do our muscles all of a sudden, okay, I can't do that 12th rep? Well, I don't have enough energy and I don't have enough oxygen. It's the GHK that starts that process. So there's a couple of important things on how it affects heart health. When you think about telomeres, that's another thing. We have shortening of the telomeres. The GHK plays an integral role in repairing our telomeres. What about mitochondrial dysfunction? If we don't have full energy in the mitochondria, our cells aren't able to have enough gas to detox. It takes energy to get rid of stuff that you don't need. So what happens now, the cells don't have enough energy to do that. And so I'm going to put it over here. I can't get rid of it. I'm going to store it over here. Starts to get stored in the tissues. That is one of the causes of early aging. I don't have enough energy to do it. I can't maintain my skeletal muscle because I can't exercise. And then there's a whole cascade of events that happen, making it so my metabolic rate goes down. I don't have enough muscles to keep my BMI up. So those are some of the things. And the another thing would be, for example, we have genomic instability. When we get exposed to toxins, we get variants, or not variants, but actually mutations in the genes. It's the GHK-Copper Peptide that protects those and actually can reverse the damage. Actually, as soon as you start using GHK-Copper Peptide, 4,192 of our genes get repaired that have been oxidized. Our body uses that to repair the genes that have been oxidized. So it reverts them to a younger state. The other thing that it's well known in the literature, it's not something that somebody I know made up, it's just in there. It actually turns on the genes that activate our little factory that makes pluripotent stem cells. So you think about stem cells are a buzzword. If you can elevate stem cells, there aren't many things in the body that can't be beneficially affected, like my heart. I didn't even know I had a right bundle branch block until I'd been using GHK for about 4.5 months. My first thought was, why didn't it heal it? I've been using this for 4.5 months. But then over a period of 1.5 years, I had another stress echo done, and the report came back, right bundle branch block no longer present. And 2 docs that said, we've never seen one of those go away. So I feel, if you can imagine, I'm really happy about that. My wife, my kids, my grandkids, I'm going to be around longer. I'm going to be productive longer, not have this slow decline into frailty and disability that seems to be the accepted way now when you get older. I'm going to be 70 on my next birthday, and I feel younger than I felt when I was 50. And especially now that right bundle branch block, and there were warning signs. Sitting in my practice, writing notes, and all of a sudden, everything just went black. And I had just adjusted a friend of mine, and I said, Mike, I just blacked out. And he said, you didn't change it, nothing happened. And that happened twice. And we managed, that didn't happen again. It must be good. Must not have been nothing. It must not have been anything, I should say. So I didn't do anything about it. And then I went in and I had PVCs as well. And I had this test done. The cardiologist came in and he said, well, your heart responded well to exercise. And I knew that because I didn't have PVCs. They only occurred at rest. And I think that's pretty much what happens with PVCs. Rest, you get them, and you don't when you're exercising. And I felt better when I would run. So I'd run 40 or 50 miles a week, no problem. But then at rest, sometimes it would go nuts. Well, 2 weeks after I had that stress echo, PVCs are gone. 1.5 years later, the right bundle branch is gone, branch block. And at that point, I said, you know what, I have to get this word out to the public, and that's why I wrote in your book, Kim, increase your ripple effect is by telling people about this reverse aging peptide that can make it so there isn't that slow decline into frailty that I talk about when I'm seeing the GHK-Copper Peptide. So those are some of the top reasons we age. There are more. I want to make sure we have time for that. One more thing, though, on the brain. Cognitive decline doesn't directly it's not really a cause of death, early death, but the effects of it can be taking the wrong medication, tripping and falling, not being alert and aware and getting hit by a car or something, or having an accident. But it's the GHK-Copper peptide that escorts copper through the blood-brain barrier to get it into the brain where it's needed to make neurons, neurotransmitters, and synapses. And also BDNF. You have to have copper to do all that stuff. It's GHK that delivers it and then holds on to it until it's needed. So it's not, free copper building up in the brain. It's attached to that peptide. And so it acts like just a chaperone. Yeah, you guys need copper. Yeah, you need a little here. You need a little here. I got to make some more BDNF. I'm making new neurons.
That would be an obvious question is like, can you overdose? And copper is definitely one of those things people become mindful of in terms of having too much. But I like what you just said. It's more of a, what was the word you used? I almost thought of like
chaperone.
Chaperone. I was going to say babysitter.
Yeah, kind of.
Unless,
copper gets out of line. It's not good either.
Yeah. And you can see these questions too, but thanks, Dr. Merrick, for writing and asking questions, and encourage all of you to do that. We are definitely going to dedicate a little bit of Q&A at the end of this. But he says, how long did you use the GHK to see the RBBBBBB resolve again? And what was the dose? And this is interesting. We're going to talk about methods of applications here in a minute. Because that's where some of this new technology comes in. How many of you, if you can write in, have been using copper peptides, like pre new regulations anyway? Have any of you already been using it in your practice? You've been doing injections? I'll tell you, one of the reasons I was turned on to Dr. Harmon's when I saw some of his new stuff come up is because I have taken them, I have injected them, and I hate injecting them. I love peptides. I take a lot of peptides orally and injectables. But I hate taking this one because it burns. I have messed around with where I put it, how I put it, how deep it goes, all sorts of stuff. But for me, and I've had a couple different companies that I've used, for me, I inject this and it burns. It doesn't just burn in the injection site. It burns all the way down my leg or my arm or whatever, my belly, for the entire day. And I don't want to take it. Like, I want to look good because that's the beauty thing, but I don't want to take it. And then that said, it's also been something that's been given some restrictions in terms of pharmaceutical laws. But yeah, I know there's also the topical way of doing it, and we'll let Dr. Harmon really go into this. But and Lexi, I mentioned her as doing our aesthetic class, and she does a lot of peptides. She's spoken for me a couple times on peptides. She is one of my personal practitioners also. And she's injected these copper peptides for scars, for acne scars, for incisions, and she uses a little Procaine and some different stuff. But again, the laws have changed, or the restrictions have kind of been a moving target lately. So Dr. Harmon has a really interesting new way of, I don't even know, it's not administration. It's not, anyway, we'll get to that point, and to answer that, the dose becomes a topic of conversation. But I did want to ask about one other thing you talked about, we talked about in a separate conversation, was pain and inflammation.
Yeah, it's an anti-inflammatory. It has anti-inflammatory effects. It is huge for helping people with pain. I've seen some literal I mean, according to medical standards, miracles. But there's this, one of the actions of the GHK is that it elevates stem cell production. So if you can repair something rapidly, the source of the pain goes away. So that's very helpful. We'll elevate somebody's peptide, and all of a sudden, this chronic or acute pain goes away. But it also has anti-anxiety effects, not just in rat studies, but in humans. Rats that after 12 minutes, these aggressive rats showed less aggressive behavior just within that short period of time. So there's so many benefits. And quite frankly, when I first heard about it, I had a little bit of a filter on, because it's good for this, it's good for that, it's good for that. I was going, how is that possible? That's why I wanted to delve into the research and find out for myself. Testimonials are great, but I like to know why that stuff does that. Why does it do that? And then I had a nurse who was in nursing for 22 years. 5 days later, she said, after 5 days, I was doing wall squats and walking without my walker. And I said, Deb, that's a dream you have. That can't be true. But we judge things from the standard, which doesn't include elevating your own stem cells. We think that things can't happen because they haven't happened yet. Yet when they do, it actually sets a new standard, because now you have something that's anti-pain, that also elevates your own stem cells, that also increases circulation to things, because where there's hypoxia, you get more capillary growth. That's why the GHK-Copper Peptide is known as the emergency response peptide. If you think about it, if you're cut, you're in battle, anciently, you get a big old cut in your thigh, something's got to happen really quickly or you're gone. So you got the rapid infiltration of new capillary growth, you have the release of stem cells, you have the rapid wound healing, collagen repair. That's why they call it the emergency response peptide. So there's a
tie it all
reason
together
why it can do all of these things fast, because it's the emergency response peptide. Unfortunately, as we age, from about the age 30 on, it starts to decrease. Our own little GHK-Copper Peptide factory starts to decrease the amount that comes out, that is made in our body. Increasing it, you start to turn back the clock, lengthening the telomeres, getting better circulation and stem cells. So a lot of good things can be affected by that.
And I'll just note one other thing. We don't have to talk about it much, but you also mentioned the increase in antioxidants that copper peptides, and maybe it's just GHK, but that it induces, right? And the redox balance, which I think you mentioned a little bit, and that's again similar to ozone, so it's kind of fascinating for me. But obviously, the more antioxidants we have, the longer we live, the better we feel, right? That's our natural response to oxidative stress. So that's going to be a big factor as well. And then just one last thing is, again, he talks about all this right off the bat in the book, like the basic things and then the basic misconceptions, and then goes into depth. But one of the misconceptions that you already brought up, it took you 4.5 months to notice. Some people it's instantaneous, but the expectation of instantaneous results, and maybe that's even what some of you are typing about here, where you tried certain applications and didn't notice anything. For me, I love to feel something, love to see something, but when I have the knowledge of what it does, I'm like, I don't have to feel or see anything else. I'll keep doing it the rest of my life. But not everybody's like that, right? And especially if you're paying a lot of money for a product or an injection. But the expectation that your body's just going to heal and repair, and you're going to actually notice that instantaneous. We all want that, but not realistic.
Yeah, ironically, had I not had the two stress echoes, I never would have even known I had a right bundle branch block, and it would have gone away, and I wouldn't have even known that it was there. So if you're measuring, and I ask people what they're going to be measuring, well, it usually involves pain. pain, it's easy to know when the pain goes away, but it's not easy to know when your liver has been repaired or your bone density increased, or, you're like me in the heart, something happened. So unless you're measuring your body, your chemistry, blood chemistry, liver function, kidney filtration, bone density, and all those things, there are lots of things that can happen. And I would actually rather not know that I have a bunch of, or be conscious of a bunch of things that I'm focusing on, but just know if you increase your stem cells, every part of the body can be fixed or repaired and regenerated over a period of time. So I tell people, you should count on using them at least a month for every decade of your life to get, because you're activating stem cells every day. As we know, that doesn't happen overnight. But once you get to the point, there's our bodies kill off 50 to 70 billion cells a day. They're supposed to, but when you run out of resources in stem cells, it starts to let them live and they become senescent cells. It's a new term called zombie cells. Now they're not doing their job, they're just sucking up your energy. When you increase your stem cells, all of a sudden the body says, I can start killing guys off again. So you get death, like the Oprah show. You get a coffin, you get a coffin.
So in terms of that, do you see, or could you expect some sort of detox reaction even because you're now sloughing off these senescent cells?
You have to go through a little bit of a detox. You have to process the debris of that. And I'll address that when we're talking about how to get these. If you have any hiccups in your detox pathways, like some genetic variants that I have, just for one, MTHFR. If you can't methylate, it means you can't detox very well. But if you have, let's say, some blockages in your drainage funnel, either the bowel, the kidneys, the gallbladder, the liver, the lymphatic system, or the skin, it's going to create some hiccups. It's not a side effect of GHK. It's your body's inability to handle that detox, that initial detox. Most people they don't notice anything, but if you have some variants or hiccups, I call them stoppages in your detox, it can be a little slow. You just slow it down. It really isn't a side effects. It's the body's inability to do something, to accomplish something.
All right, and an effort to stay on time, which I hate cutting things short. And I guess if we go over an hour, but people are interested, we're happy to do that too. But I was going to move into the different applications, but these questions kind of remain in this part of the conversation. And if you're Dr. Buddy Green, is that who I'm seeing? Alan Green, thank you. Welcome. Nice to see you. He says, which cells produce GHK copper?
They're produced in the skin. And that brings me to how you can get them. You want to spend a little time on that, Kim, on how to get them? Okay. So one of my good friends, Dr. Michael Karlfeldt, does regenerative medicine cancer care. So he does alternative cancer treatment. He just wrote the book called A Better Way to Treat Cancer. We were actually in the same clinic for 6 years. And
he's from Sweden, right?
What's that?
Isn't he originally from Sweden?
Yeah. So he and I wrote books at the same time, unbeknownst to each other. But I asked him, I said, because of the anti-cancer properties of GHK, do you use them in your protocols? And he said, absolutely. We do infusions of GHK. And I forgot to mention, it actually turns off 25 cancer genes that people who are predisposed to cancers have. They have these genes. It's the GHK that turns those off. And it also resets the cellular death cycle in some types of cancer. Cancer cells are cancer cells because they don't get the message. I got neighbors on all sides. I'm just going to keep dividing. And now we invade the neighbors' lands, so to speak. So he uses them. He gives infusions. So you can get copper peptides through infusions. You can get them through injections, or you can get them in lotions and creams and shampoos from dermatologists. Or there's a new technology that's a phototherapy technology. And in order to explain that, I'm going to do a screen share here for a second. I have a
It sounds
couple of
like while
slides
he's
that,
pulling that up, it sounds like many of you have experienced the creams and topical stuff. Some of you are definitely have been on the bandwagon with injections. Courtney, thank you. Welcome. I know you use a lot of them, or have at least in the past, but it also creates its restrictions as well. Like we know with some of those that have been created, or if you're like Dr. Harmon and you're not able for your state to do those types of injections, then creams become, I think, your only option, right? And Dr. Carl felt to do IVs, like that's what you're talking about, infusions, IVs
yeah,
for, interesting. I've never heard of that before being,
he has an MD in his practice as well.
yeah, but is it the same formulation that you would do as IM or sub-Q injection with?
Yeah, it's GHK.
Interesting.
Hmm. Okay, so everybody knows when you go out in the sun, somehow magically we get UV, we get vitamin D. How does that happen? We have trillions of nano antennas in our skin. The UV light frequency excites those nano antennas, and basically the body interprets that as a signal to start converting this to vitamin D3. Similarly, well, to understand the mechanism I'm going to talk to you about, when you go into a jewelry store and go up to the diamond cabinet, there's always bright lights shining on them because they want them to pop, right? You look at them and they're clear, but we see all these colors. What is that? Well, the white light is being refracted out into different wavelengths that are interpreted by our eyes and brain as colors. Our bodies, researchers in Japan figured out our bodies glow. We emit lots of different frequencies, even in the visible spectrum. You just can't see it with the naked eye, but they could measure it. This is what powers the phototherapy patch I'm going to tell you about, because it is the power source of a phototherapy patch. So basically, there's a patch that has a new crystal lattice structure that doesn't occur in nature. The inventor was first commissioned by the Navy to come up with a way of increasing energy production in Navy SEALs in long missions on submarines. They were getting addicted to amphetamines. And so he figured out they wanted him to come up with a way of naturally increasing energy. So he figured out, what frequencies do we emit? If I could select one of those out and get it back into the body, what could I do with it? And then how could I make a crystal structure that would refract out and reflect back into the body that frequency? And so there's a combination of amino acid, salt, sugar, stabilized oxygen. That's the proprietary information that's patented, that actually signals your body to make more GHK-Copper Peptide. You don't have to have an infusion. You don't have to have an injection. It signals your body to make your own copper peptide. So you wear the patch 12 hours on and 12 hours off. You throw it away. Or if you have a pet, after 12 hours, put it on your pet, because it'll last about 24 hours. It'll do the same thing for your pet. So that's how they work. That is the technology. So you have a situation now where even grandma who has cognitive decline can remember to put a little band-aid on C7 back here at the one of the important acupuncture points where the testing was done. Back to the story about the Navy SEALs. He figured out how to turn on beta oxidation for energy. So a long-term sustained energy. That patch, called the Energy Enhancer, was the one that was used by the U.S. Olympic swim team, the men's swim team, in 2004 with Michael Phelps. And that's why they won all those medals and got investigated for doping. But it wasn't doping. So they won all those medals. The next Olympics, there were over 300 athletes using that. And so it turns on beta oxidation in the cells, in the mitochondria, for a sustained amount of energy. So we burn 300 to 600 calories a day by wearing that patch. Fast forward to 2018, the
It's
same
a weight
features.
loss patch. Is that what you're saying?
Well, kind of. It's not touted as that. So
I know.
you have a situation where, yeah, you're burning more fat calories. But in 2018, he figured out what frequency in the stimulating the skin turns on our ability to make GHK-Copper Peptide. And so in 2019, there was a study done, a blood test study, where they actually measured, it was a double-blind, randomized, placebo-controlled study measuring blood levels of GHK. So in order to assess what are the potential benefits of wearing this patch, what we need to do is turn to the literature and look at what the GHK-Copper Peptide does. That's already proven. Well, it was proven through the blood test that wearing that phototherapy patch elevates the GHK-Copper Peptide. So that's what I put in the book. And that's why there's so many things that I goes, it can't do that much. But then I found out that it does. And it did for me. So that's the other way, the easy way of getting GHK-Copper Peptide and actually getting your patients or clients using them, because the treatments you do are going to be more effective. That's from the literature too, even things like red light therapy, laser therapy, because the GHK with the copper facilitates those pathways. It increases energy production because it actually influences cytochrome C in the mitochondria in that final stage of making ATP. So all of those therapies that you do are going to work better with the GHK, but then also elevating stem cells.
Okay, so to be clear, do you have to worry about elevating the peptide too high? Do you need to do any testing prior? Obviously, there's testing to prove if it's going up or not.
Right.
If you're using whatever application you might be using, you could test to see if it's working, but
there isn't any literature. There's no talk in the literature of any GHK toxicity or anything like that. It's more of the patch brings it back up to what it was when we were 20. Did we have wrinkles when we were 20? We didn't even think about it. We have joint aches, not really, unless we had a really bad break or something. So it starts turning back the clock. My hair, I have to show you. Let me share this again. Not that I was looking for this, because I didn't really care that much. But so here, I want to show you this one too. Athletes all over the world are using it. Here's David Beckham. This was the Olympic swim team. This was a fingertip of a little boy. It actually is meaningful to me because I showed this at the Energy Healing Conference in St. George, Utah, about 2.5 years ago. And there was a woman in the audience who saw it. And the dad convinced the surgeon, who had initially refused. He said, it's going to die.
yeah, it looks dead.
There's no capillary growth. Well, it died. There's the necrosis of the plaque of necrosis, but it rapidly got infiltrated with capillaries. So the fingertip was saved. You can see a little dent in the fingernail right there, but he still has his fingernail. The effect on skin is tremendous. This was over a 2-year period with this guy. Look at this age spot that almost just totally faded. And then right here is huge. And I wanted to show you, this is a friend of mine, had a Mohs procedure. And not only did that heal with almost nothing, but this age spot is, faded a lot. But that's not what I wanted to show you. I wanted to show you, I'm going to get out of this. But
So again, different applications, obviously, if you had access to inject it directly, I mean, I instantly think of several things: silver, ozone, systemic stuff. You could use creams and so on and so forth to help with all of this.
that's how gray my hair used to be. At about 4.5 months, it started changing. It turned brown from back to front. It was the weirdest thing. A friend of mine said, do you realize your hair's turning back brown? I said, no, it's not. And she said, bend over, I'll take a picture of it. So that was that. So everybody's experiences are different. mine were overall, generally, but in my heart, and first happened in my hair. I didn't even know I had the right bundle branch block at that time.
Yeah, so Dr. Merrick, again, are there clinical trials on this patch? Now, I was talking to Dr. Harmon earlier, by the way, and he said, these professional athletes and stuff, and all I knew is patch, which again, my experience was not great. I didn't want to inject it. And so I'm thinking a transdermal patch. This is exactly what I need. It'll just slowly over time release it. I love estradiol patches. Anything that can be in a patch, you don't have to swallow. And I truly believe that compliance with patients is not, it's proven, is a big issue in medicine. No matter what it is you're prescribing, getting them to do it and do it well is a huge issue. So the
Right.
easier we can make this, again, I thought peptide patch, which if somebody could create might be its own genius, but how is that legal? Dr. Harmon says, well, yes, WADA and other professional athletic entities, it's all fine. And then also how to get, I gotta say this correctly, not around the 3-letter agency, but how does it all work? So I think leading into Dr. Merrick's question on the clinical trials or
Yeah.
the information around this particular method of application.
So they have clearance as wellness devices. The company doesn't do research and clinical trials on specific disorders or diseases, because then you're going to fall into the FDA. What they concentrate on looks like I'm blurry. Does the patch elevate the GHK-Copper Peptide? The clinical trials have been done on GHK-Copper Peptide. Those don't have to be done. But the trial, or the test, the double-blind randomized placebo-controlled trial about the GHK getting elevated in the bloodstream, that's been done. That's been proven in blood tests. So once you start saying this treats cancer, this treats cardiovascular disease, now you're in a totally different realm. And that's not where that company wants to be. So you have to look to the research that's done on the peptide that gets elevated in the blood when you wear that patch.
So can you share any numbers like pre and post patch and on levels of GHK in a certain demographic?
I actually contacted a blood lab and asked them if they would make a GHK saliva strip, test strip, or urine. And they said, they called me back about 5 days later. They said, well, we don't think there's enough money in it. So they didn't make one, but I thought that would be cool. Take your blood test, your GHK level, and then, do it again in 24 hours, and then in a week, and then, 2 weeks as you're using that patch.
But you mentioned that
I
the
think
patch company has actually tested this, right? Clearly, they have tested and been able to show that using it raises levels. So is it like, I know they've done this with the glutathione too, and you said, well, actually it was David Schmidt that said it's like 30 to 40% increase in glutathione using something different. But so what is it here in what span of time?
the GHK,
Yeah.
it showed, they took blood before they started at 24 hours and then at 7 days in this group of people. And they all, the control group, just their level stayed the same. But the participants in the study had dramatic increases in their GHK. It was actually that study that was presented to the US Patent Office where the patent for the technology was granted. It was that study that got them the patent on the technology, the 20-year patent.
So I'm guessing like age plays a part, compliance plays a part, right? Like, and therefore there's probably a range in percentage of increase,
Yes. And also, if someone has a really poor diet and they're not getting enough copper in the diet, they need to supplement, because if you're going to make GHK-Copper Peptide, you need copper and you need protein, because the amino acids are used to make the peptide. So yes, everyone's diet is different. Everyone has different genetic variants. And I'm going to turn the light off and then back on here and see if my camera can
And again,
reach
I'm
out.
guessing the age, like the more depleted you are in things like stem cells or even the peptide directly, the longer it's going to take to get to a place where maybe you see the levels go up or you see the results. But I was going to ask this question and thought I just would sound super stupid, but I trust Dr. Merrick. So what blood marker are they testing to evaluate the results?
The GHK-Copper Peptide.
Is that just like you could draw blood and send it off to the lab and say test GHK-Copper
Well,
peptide?
it's a little more complicated. They have to flash freeze it. The GHK half-life is quite short, goes glutathione. So when they did the glutathione test, and for those of you who are kind of in the dark, the company actually makes a glutathione patch that signals your body to make more of your own glutathione, and it raises glutathione levels on average 300% within 24 hours, whereas a supplement can raise it maybe 10%. It's the same technology, but different crystal lattice structure selects out a different frequency. That frequency tells your body to make more glutathione. So it's almost like getting a glutathione IV, because it raises the level so high. So yeah, it's the GHK-Copper Peptide. That was their sole purpose of making the patch, to raise that level. Once they proved that, one also just needs to turn to the literature all over the place. There are 91 references in my book, different studies that have been done when I'm going over a different chapter, like the brain and how it helps regenerate, and it helps repair neurodegeneration. And, in the brain chapters, and then each chapter, different references. So that's why I go back to, if you want to know what this patch can do, just turn to the literature on GHK. We know that it raises GHK-Copper Peptide. Sometimes so quickly that when you put it on someone and they look at you like, wow, I feel this like vibration up into my head, or warmth in my head, or oh my gosh, my back pain went away. That's what I call a one patch wonder. I was not one of those people. It took me 4.5 months before I noticed much.
Well, I know, especially in this industry, that research, data, clinical trials, approval, all this stuff really, really matters. But then the proof is in the pudding too. And some of these testimonials, we're always looking for case studies, et cetera, whatever we want to call them, right? So you have yours
There are over 80 studies done, by the way. There's
on the peptide and what the peptide does. When was it
well,
first discovered?
what's that?
When was this peptide first discovered?
1973.
So it's been a few years.
Now the company has done over 80 studies. There was an organ function study done, for example, on the X39 is the name of the patch, on the raising your GHK. So and I was oddly attracted to the cardiovascular portion before I even knew I had a right bundle branch block. But they did all kinds of measurements, both traditional and energetic measurements. And after 6 weeks of wearing that patch, the cardiovascular systems acted 2 months younger. So I did the math. For every day you wear the patch, the cardiovascular system gets a third younger. And that played out for me over a period of, it was about 2.5 years that I'd been using it at that time, when I had sometime in that time period, some point that right bundle branch block went away. I don't know exactly when, because I know when I did that test, what I know about that. Now, can I say that it was from the patch? No. I mean, not 100%. It wasn't a double blind.
Spontaneous remission, though.
Yeah. So more likely than not, because doctors said they've never seen one go away.
I want to share my quick testimonial or experience with it. But first, what about your practice in terms of brain health, PTSD, autism, ADD, depression, anxiety? What types of things have you seen in your patients?
We use them as part of our protocol. So we're doing microcurrent neurofeedback. We're doing laser therapy to activate parasympathetic. There's certain frequencies of that laser that activates specifically the parasympathetic nervous system. and we use like autonomic balancing. I do testing of the autonomic nervous system. There are 14 functions that only get neurons from the parasympathetic. I test those, we activate that. We look at the balance between the fight or flight, rest, digest, teeter-totter relationship, and bring balance to that system in the primitive brain and the autonomic nervous system. And then the hubs and networks up in the upper brain can start to adapt more to a normal level, and they don't misfire and get all those symptoms. That's kind of oversimplified, but that's what we do. And we use the patch because it helps with coherence. I used to do quantitative EEGs, and that's my certification. But with this new system, we don't have to do that anymore because it doesn't train the brain, it untrains the brainstem from the faulty. So what I don't have any, data or maps of changes in the brain map. That study was already done, and that is what was done by an outside agency where they used the X39 and did brain map studies at the beginning, at 3 weeks, and 6 weeks. All of the participants had less hypercoherence and more and less hypocoherence, or coming to normal. It had almost an adaptogen effect where it was the brain was overpowered in coherence or underpowered. They both trended more towards a normal balance. That study's been published. I can get anybody information on that as well.
So fantastic, because I think one of the things you just said is that you don't use it as a one patch wonder or a one tool in your toolbox approach
Right.
either. It's part of a program for your specialty, and there's connections to the research, et cetera, and why you would do that. And therefore you couldn't say that the patch alone or GHK alone was responsible for the results that you see. But I was just in his office and seeing some people and sharing some results, and I know he is getting results through his programs. Really quick on mine, my oldest son is 24 and 3 weeks ago had a basic or routine inguinal hernia repair. And so he's got 3 little, I don't know, 2-inch incisions across his belly. And I thought this would be a really fun test, because how many people have the same, same body, same makeup, same date of the surgery and incisions, et cetera. And we could do a few experiments to see which one of these heal the fastest. And I used the patch on one, and then I did injections of ozone and procaine. I didn't inject any GHK, even though I have some. And then nothing. And by the way, I did not tell him anything about this. I did not tell him what it would do, why I was doing this. He's been my guinea pig for a long time. So he just kind of lays and takes it and doesn't mind needles. But what was super interesting, so I didn't say anything. I just said, wear this patch on one of them. And I don't hardly see him, he's 24, he's coming and going. But eventually a couple of days later, I was like, hey, so about that patch. And he's like, Mom, it totally made a difference. So he's, again, like I say, 3 weeks out. There's still some scabbing on those, but he can feel the inflammation still on both the outside and the inside. And he said it just helped. And I was like, please try to help me quantify that. And he just said it went flat. There was no inflammation or redness, that he can't grab it and feel anything on either side. But he said he wore the patch for 4 hours, which irritated me because I paid money for those and you can wear it for 24 hours, but I didn't tell him anything. I didn't give him any instructions. I just said, wear this. And he said, after he took the patch off, some of that came back. So I said, all right, here's some more patches. And he said, while he wears the patch, it's flat. And as soon as he takes it off, he has no pain, no inflammation. And a couple of the scars or scabs even fell off. And the other two, I took a picture of them today, but the other two, they actually still look more red and purple around it. The other thing he said was it's itching, right? It's healing. And so they're itching. But he said the one that he put the patch on didn't itch.
Yeah. I hear stories like this all the time. And
Really
interesting,
fascinating.
we have patients who come in for brain stuff that they'll have an accident or get a cut or break their leg or something will happen. And I don't really have to change anything because it's kind of it has a global effect on repair. It's the emergency response peptide. So there's all these other side benefits to it as well. I don't say use this patch for your brain. I tell them about the study that was done that it helps with coherence, normalizing coherence. A normal amount of crosstalk between lobes is good. Too much or not enough are both undesirable and are not good. So that's why I've incorporated the protocols that all of you practitioners, or if you do some kind of therapies or whatever, will all be affected by having someone elevate their copper. Interesting side note, the company just launched yesterday their new eye cream that actually has GHK in it. So you can get it from the inside out and the outside in. The global launch of their new eye cream with GHK. I have a couple of friends who said, I'm smearing that all over my head so I can regrow my hair.
Well, again, you can do injections, but if you can get the peptide, but that was one of the specific interests with this, is just knowing that it's hard to get, although I've come up with a new resource on that I hope to bring him in and share that. Just different ways of manufacturing. So it circumvents or is not pharmaceutical, but still pharmaceutical grade. But it's tough to get. And again, it didn't feel good for me. But it has all these benefits. And again, I wanted it to be safe and also compliant. So this technology is fascinating to answer some of these questions. So Buddy, my son has those 3 incisions, again, all 3 weeks old. And I had him put it on one incision, like right on it. And Dr. Harmon, I don't know if that's the right way to do it or not, but I was actually just trying to see if the scar would heal faster or look different. He's 24, he doesn't really care. At the same time, it's like it will show, it's visible every time he takes his shirt off, and it's these 3 very distinct linear things. So I had him put it right on there, and when he came back and said it worked so well, he wanted to put it on all 3. So I gave him 3 patches to put it on all 3 little incisions, and I told him to put it on the one that's lower, where the hernia actually is, right? These were the scope incisions, but the hernia is actually much lower. And we went with I don't even want to admit it, but it was his choice, synthetic mesh inside there. And so I was curious even about putting it in that area so that even heals and maybe even modulates the immune system a little bit in terms of how it responds to that synthetic piece in there. But that's how we did it. I know that the patch people, the research has shown, Dr. Harmon talked a little bit about the back of your neck. I've worn that on the back of my neck probably the last 4 or 5 days. But an even larger systemic approach is to do it what they say right below the belly button. And they stay on, it's 1 patch per day. They stay on really, like, so I work out a ton, I sweat a ton, which means I also shower twice a day, and they'll stay on all day. But once I hit the shower or the sauna, now they don't stick as well, but that's about 24 hours for me.
The interesting thing about that is the adhesive is the same adhesive in the brand name Band-Aid. And so it's hypoallergenic, made by 3M. But still, 1 in 10,000 will have a reaction. I'm one. And so I don't actually wear them on the skin. You can put it on the inside of your clothing with the non-adhesive side facing you. It's just the same stuff. Opposite side, the adhesive side just has adhesive on it, so it doesn't matter which side. So you can actually put them on the inside of your clothing. So if any of you have any issues with adhesives, you don't have to worry about that. And then at the end of the day, after your 12 hours, you can actually put it on the underneath side of your collar of your pet, of the collar of your pet, and it will do the same thing. I've had patients tell me, my dog was so arthritic, he couldn't jump up on the couch anymore. And I was like a little teenager jumping up on the couch. So it's very powerful in relieving pain, regenerating things like, ligament, cartilage over the long term.
All right. We are running out of time, but I did want to just address this one thing of like my son, he said when he wore it, it was great. But is this something everybody would need to wear for pain long term? And I also asked the question of like, it might help inflammation, it might help with the immediate or acute pain. But what about when there's actually a true problem, whether it be musculoskeletal, whether it be an infection, like, I mean, you don't want to be masking anything either, or alluding to the fact that you don't need to go get further intervention because you're wearing a patch.
Yeah, everybody's problem is different. You can have a torn cartilage or a torn ligament and still need
Yeah.
to, do proper bracing or taping or a cast, whatever. But when stem cells start to work, you can't just expect to be, I'm going to go back in the gym tomorrow. There's still that healing that has to occur. I'm not quite. Oh, I wanted to address. You asked about if somebody needs to keep wearing it.
Mm-hmm.
Yeah. So I kind of jokingly say to people, well, you should stop using it when you want the aging process to speed back up. So
Yeah, I
it's
mean, systemically, I totally see that, right? Like, I mean, it's like taking vitamins, it's like brushing your teeth. It's like we are creatures that require maintenance if we would like to live well and
yeah,
feel.
and if you once you start elevating your stem cells, you don't really want to stop because you got to work in progress. But you get to a point where now you start to win that battle between, cells that are senescent and cells that are new. We when I started using this at age 66, my stem cells were old. We get senescent stem cells too. So now you have an increase of pluripotent stem cells every day when you put that patch on. There's tremendous regenerative properties in that long term. And I think, most of the people who start using them are going to keep using them because of the reverse aging type of effect that it has.
Yeah, and I suppose as long as you can keep that anti-aging effect going, who knows where the body is going to send those healing peptides or stem cells or whatever. I think this
Yeah.
is true whether it be ozone, whether it be NAD, whether it be stem cell or exosome. Like the body's intelligent, right? It's going to send it where it needs to go. It may have the potential to truly heal. Like, I mean, to think that we're ever fully curing somebody entirely forever is kind of ridiculous, right? But to give the body what it needs to maybe reverse or improve. But while somebody might be in acute pain, I think the patch could be used that way too, right? Or maybe it's a situation that isn't going to go away, but it can help be a mitigation for pain or discomfort that can help them function better.
Yeah.
We've had this question a couple times. I am guessing there's no contraindications with using it with other peptides, other injectables. BPC 157, TP 500 was asked, methylene blue. Any contraindications with increasing your
No,
level?
because nothing goes from the patch into your skin. It's really difficult to, if I could say that, to get like an overproduction of anything when your body's doing it, because your body has this self-modulating thing where I'm making more GHK or I'm making more glutathione. I get to the point, okay, I've already made so much, you're not going to keep making it now. People who have some serious issues or they've been injured and they need as much GHK as they can. You can actually put a second patch on. And I actually got to interview the founder, the inventor. If you use a second patch, it's not you get double the amount, you get about a 20% bump in the peptide that each patch is designed to elevate.
Hmm.
I actually did that. And, because I'm a man, more is better. One pill is recommended, six ought to do it. So I put one patch on the back of the neck, and then I put another one right over my heart. And he actually confirms that you do get an increase of that peptide. So my thought when the cardiologist came in and said, yeah, we get these apoptotic cells in the whole body. The heart's no different. We just don't replace them as fast in the heart because it's beating. And usually the heart heals with scarring. It doesn't really heal, it just scars over. And instantly the light went on. I said, aha, I have no proof of this at all. This is my own, logic. My stem cells were elevated every day, and I'm starting to replace things. They just don't know how to beat, and they're all misfiring at the same time. Because I forgot to tell that part, that the PVCs I had my whole life got really rhythmic at about 4 months in of using this patch. Every fifth beat, day and night, day and night, day and night. I thought, what's going on with my heart? That's what prompted me to go in for that stress echo. And then 2 weeks after that, the PVCs were gone. So some of what I thought may be true.
Interesting. Yeah, I thought the same thing, John Hinman, like, just to me, again, compliance, ease of use, these are very affordable, cheaper than injections, cheaper than creams. Like, this is super inexpensive in comparison for any patient, obviously depending on how many you use, but yeah, to go along with things like VidiPure products, Ebu. You guys know I love IV, I love Ozone, I love doing glutathione, I love injecting that stuff. And I think you can do those things still to be or a loading phase, right? Hit the system hard with higher doses and maybe even at some point maintenance. But again, compliance, cost and affordability, availability, getting your patients in and out of the office. I don't think that this would replace necessarily those things that you do. You're not going to lose patients or lose revenue, et cetera, but it actually might enhance all the other things that you do, like Dr. Harmon talked about. And there's not any contraindications to doing it. And by the way, this company has lots of patches with different frequent, what did you call them? Patterns or?
Well, each patch elevates a different peptide. So
Yeah.
my second book I'm working on right now is about one of the other peptides, known as the fountain of youth peptide. Almost done with it, but there's a silent night patch that elevates melatonin. There's an eon patch that decreases inflammation and activates the parasympathetic nervous system. We use that in my practice as well, because that's part of our goal. There's a carnosine patch that's one of the ones that the U.S. men's Olympic swim team used in 2004 because it elevates carnosine. Carnosine has huge cardiovascular benefits, but also muscle maintenance and muscle building. So, I mean, I don't want to throw so much information because it's hard enough to get, all the understanding about the one that elevates GHK, but for practitioners, you have an arsenal. And even if you do stem cell injections, you can have a conversation with the patient and say, we're going to give you this injection with this many billion stem cells, but then we're going to give you this phototherapy patch. I want you to use it every day because it'll elevate and you keep it going. Those stem cells we inject you with may not last a long time. The ones that die off because of the inflammation, and that's, they can't give you steroids because steroids are anti-regenerative, and so it's a crapshoot.
I love the premise of something daily. I think, I love to be empowered myself, right? Something you're doing, but yet it's hard for compliance. But the food we eat, the exercise we get, the supplements we take, the injectables we might bring in, and then the visits to the practitioner, they're all going to lead into a better, longer life, right? And I agree with what you're saying. And activating the body to do its own thing naturally is just, again, a premise that
right.
I'm super passionate about. So, excuse me. I want to let you all know that we are definitely over time, if you didn't notice, and we appreciate your engagement and we appreciate Dr. Harmon. He does have all the information. So there's a couple things here. He wanted to offer to my guests here, our MedMasters following our groupies, a little bit of some promotion, so to speak. So he does have a book. We put it in the chat now. Thanks, Jason. How to reverse aging. This is his first one, as I understand. He's got another one coming. So if you would like a copy of this, you could email him and he will send you a copy. For our group, it'll even be a signed copy. And now he's going to have to come up with something even better than what he put in. Because this, of course, I'm sure was just to me, but so if you want to put your name, phone number, email in the chat, we can follow that. If not, we put his contact information in there so you can get a signed copy of the book. It's incredible, it's informative. And again, it's not about a product, it is about the peptide itself and the research and studies there. There's also other places to get this. We mentioned, I love Leonard at New Bio Age. Gianna, you were talking about him, and Dr. Seeds, and there's other educational pathways there as well, but that's one of them. The second thing he's offering is to introduce you to this company if you're interested in doing these patches for yourself. Even just, this is what I did. I'm like, you know what? It's $300 to get an account, to register, get a couple months of supply and try it out, right? I got some scars, there's some incisions to put it on. I want to check it out and see what it does, see how it makes me feel. It's a few $100 to register and get that, but you get these patches. I have this whole package here. I just got it a couple days ago to give this a try, right? See how it makes you feel, or offer it to some of your patients if you know anybody who's got something that might, like my son, who's got something that might show that quicker. So again, here's his contact information. If you want to learn more about the company, more about the patches, more about the research, he's happy to do that one-on-one with you, which I think is incredible. I don't know where else you're going to get a lot of that hand-holding through the process.
And Kim, also,
Yeah.
how to implement them into a practice, whatever practitioner that you are. And I've helped regenerative medicine docs, I've helped chiropractors, I've helped naturopaths, I've helped nutritionists and energy healers. All of those people love them.
Yeah, so I think that kind of lends itself to some protocols, to some how to educate patients on this, where to place them, right? You're not looking at dosage and injection sites, but there would be some parameters to this, how to implement it for your scope of practice, for your type of patients, and just be a resource to you because you're here with MedMasters. So again, his contact information is there. But if you leave your information, he'll be sure to reach out probably in the next week or so, right, Dr. Harmon?
Yeah, well, if you could give, let me give my email to send that information. It'll be a little bit easier for me. It's DrHarmon, Dr. Harmon at GHKbook.com. That's the email. If you could send me that, your information, address and all that, that would be great. Yeah, Dr. Harmon at GHKbook.com.
All right, you guys, again, it's super affordable. I'll just throw it out there because it's $100 a month for all intents and purposes to get started on this, or to get your patients doing it. You can have like a auto ship or whatever else, the way memberships and different things work that way. But it's $300 to get it started. To me, like I say, it was worth giving it a shot. It was like a no-brainer. And I've already seen some instantaneous results. And it's that simple. So again, thank you, Dr. Harmon. We've enjoyed every second of this. Like I say, I needed some more education on the peptide itself. I knew there's lots of practitioners who are out there who are used to using it and no longer could get it or have access to it. So that became an issue. And then this new technology using your body's own map, its own design to even motivate and modulate the development, the regulation, stem cells, etc. Just was fascinating to me, and I wanted to share it with you all. Don't forget also, Vicky put in the chat real quick that for 24 hours or until Friday tomorrow midnight, you can get discounts on our classes as well. If you go to those links, you can go to our website, medmasters.org. But she put those links in there directly. Some of you have already taken that, some of you are already experts, but for those of you who feel like you need to increase your knowledge, you get a discount for being here today. So we'll be doing this every month, a new guest, a new topic, and inviting you to that. We really hope you'll stay with us and hope you enjoy your night. Thank you.